Do you guys measure lactate? You guys look at lactate in critically ill patients? So in the United States right now, every criticalist must measure lactate, because if you take away the lactate, they are lost. Okay, so everything now has to have a lactate. Even if the dog just by mistake walked into the emergency room, they have to measure lactate. So there is a recent paper looking at GDV, gastric dilation volvulus, and the prognostic value of lactate concentrations, and the cutoff number was 7 to 8. So what that means is that if a dog has a lactate of over 7 to 8 millimoles per liter, they were significantly more likely to die than if they have a lactate of less than 7 to 8. Normal lactate is about 1 to 3 or 1 to 2. A greyhound finishes a race with a lactate of 29. All right? Now, when you read the books, they tell you that is incompatible with life. All right? And greyhounds don't know about it. Do you guys do blood gases at all? Yeah. Yep. Okay. So when does a low pH bother you? If it's below what number? So let's say you have a critically ill dog. 7.2. 7.2. I start going, oh my God, let's call the priest and find out what's going on. All right. So this is a post-race blood gas from greyhounds. All right. So look at their blood pH. Does it freak you out or not? It freaks you out. So what I just actually did a seminar for the intensive care interns, and I made up a case, and I gave them the blood gases of a greyhound after a race, and they were going, well, this animal cannot be alive. And we said, well, here he is an hour later. And they said, what did you treat him with? We said, we didn't treat him. Well, that cannot be right. So basically, look at the bicarb. 3 milliequivalents per liter of bicarb. For those of you who don't do blood gases, you guys, anytime we see anything below 10, we really freak out. So 7.2 for pH and 10 for bicarb, it really, it makes a certain muscle of your body contract spasmodically, all right? Okay, so we're in a quest to try to figure out how greyhounds actually buffer that rapidly, because they do it in an hour. So in an hour, we know the pH is back to normal, the bicarb is back to normal, and the lactate is back to normal. So we've been looking at a lot of different things. So we've done lots of blood gases in greyhounds and galgos and a bunch of other long-nosed, long-legged dogs. How many of you guys remember the oxyhemoglobin dissociation curve? Any of the youngsters remember the oxyhemoglobin dissociation curve? A little bit? Maybe? Perhaps? A lo mejor? All right. Okay, so remember, the hemoglobin has a sigmoidal shape. So remember, this is oxygen, and this is partial pressure, all right? So this is saturation versus partial pressure. And if you turn the curve to the right, okay, so if you slide it to the right, or if you have a right-shifted oxyhemoglobin dissociation curve, you actually release oxygen more freely to the tissues, all right? If you have a left-shifted oxyhemoglobin dissociation curve, you hang on to the oxygen, okay? This is myoglobin. So remember, myoglobin wants the oxygen in the muscle, so it has to have a left shift, so it has to hang on to the oxygen. Make sense? Let me ask you this, a physiology question. If you have an athlete like a greyhound, would you want for the hemoglobin dissociation curve to be right-shifted or left-shifted? So what do you think? You want to release oxygen more easily to the tissues, or you want to hang on to the oxygen in the blood? Release it. So you want it right-shifted, okay? You guys remember what the P50O2 is? So the P50O2 is the partial pressure of oxygen at which 50% of the molecule is saturated, okay? So you look at 50%, you draw a straight line, that's your P50. So in a normal dog, the P50 is about 34 to 36, okay? So remember, the lower the number, the more to the left the curve will be, okay? So this is 2, this is 19, this is 27. So the greyhounds should have a right-shifted hemoglobin dissociation curve, correct? How come they don't know that? They haven't read the damn book. They read a dog physiology book, all right? So this, you guys, is like 100 samples, and they all have the same P50, 26.2 millimeters of mercury. So we said, this is totally crazy, okay? The greyhounds have been around for about 7,000 to 9,000 years, we know. So how could a dog have made a big mistake and now they hang on to the oxygen, right? That cannot be right. So I'm talking to a colleague of mine who is a chemical engineer that works only on hemoglobin. And I tell him, this is crazy. Look at this data. These greyhounds have left-shifted hemoglobin dissociation curve. And he smiles like this. And he goes, that's perfect. And I go, what do you mean it's perfect? So this guy works on blood substitutes, what they're called HbOCs, hemoglobin-based oxygen carriers. So those are artificial bloods, if you may, usually made out of bovine or porcine hemoglobin. And here's what they know now. If you have a left-shifted hemoglobin dissociation curve, here's what happens. Remember, in a normal dog or cat or horse or human, you release the oxygen at the precapillary level. So you guys remember the precapillary is right before the capillary. So it's a little thicker than the capillary. If you have a left-shifted oxyhemoglobin dissociation curve, you hang on to the oxygen a little bit longer until you get to the capillary, and you release it at the capillary level. And what happens if the capillary is thinner than the precapillary? It goes further out. So the greyhounds figure out that if they hang on to the oxygen a little longer, they release it to the tissues more effectively. So what we actually did is you can actually do oxyhemoglobin dissociation curve in vitro, and I'm not going to bore you with that, but we actually look at the molecule, and you don't want to draw any of this, you don't want to copy any of those polypeptides, but what we found is pretty cool. If you look at a normal globin chain in a dog, the globin chain sits like this, and the oxygen sits here. In the greyhound, the globin chain wraps around the oxygen, and it just hangs onto it a little bit longer. And what we actually found is that every single greyhound we looked at has these 4 gene mutations, and they all have the exact sequence. So they substitute 4 amino acids, and that changes the conformation of the molecule. So this is really, really cool because it's allowing us to look at evolutionary biology, and this goes back, it's probably at least 3,000 or 4,000 year old genes. So we're trying to figure out where this guy's shifted in a different direction. So that was mainly FYI. And we have a test that allows us to look at offloading of oxygen, and the greyhound hemoglobin offloads oxygen 4 times better and faster than humans. So we really, again, I was telling you greyhounds are not dogs. Believe me, they are not dogs. So we're going to wrap up with dot plots, and then we're going to look at the cases. So more dot plots. You just got yourselves a lovely mouse pad that looks like this, correct? Isn't it beautiful? So I probably don't need to go into this. You guys okay with the patterns of inflammation versus stress versus catecholamine release? So I'm going to go through some of the things that we left out. So we actually left out the leukopenias, any of the penias in the 5 leukocyte, and then the leukemias. So what I'm going to do is I'm going to show you some cases with their corresponding dot plots. First thing, does it bother you or not to see a left shift or a toxic change in a dog? How many of you are bothered by it? Yes, good. And it bothers me a lot. So when I see a left shift, I go, ooh, this is not good, all right? Something is going to happen unless I do something about it. So I showed you this before, okay? So that's where all the normal white blood cells should sit. And again, the biggest problem that you will have with the dot plots is thinking about them the way the machine thinks about them. You're thinking about a dot plot and you're going, that cell doesn't look anything like that other one on the blood smear, okay? If I were to ask you this, if you have a nucleated red blood cell, okay, a metarubricide in the blood, nucleated red cell, early red cell precursor, if you were to find one of these guys that most resembles a nucleated red cell, which one would you pick? Would you pick that one? You'll say it's a lymphocyte, right? Because the students have a lot of trouble saying, well, is that a lymphocyte or a nucleated red cell? And then you go, well, the chromatin does this and that. To the machine, a nucleated red cell looks more like a neutrophil, all right? Because it's not looking at the shape, it's looking at how much light makes it through, how much light bounces through, and stuff like that, okay? And to the machine, a left-shifted neutrophil looks more like a lymphocyte, and I'm going to show you that. So then you cannot comprehend that because you go, well, they don't look anything like that in the smear, but the machine is not looking at a smear. The machine is actually collecting all this data that is bombarding the cell with and making a composite. Make sense, you guys? So think about this, and I'm going to show you the dot plots that go with it. Okay, this is pretty cool, okay? So do you all recognize those as eosinophils? Those are all eosinophils, all right? So the greyhounds that bark in Spanish, also known as galgos, have normal-looking eosinophils. Can you recognize those as normal eosinophils? You cannot because they don't have orange granules, all right? So the greyhounds do not have orange granules in the eosinophils. So the eosinophils have vacuoles, okay? Sometimes they have a little dot inside the vacuole. So let me tell you what happened. So last year we went to the Scottish Deerhound National meeting in Michigan, and we bled 106 deerhounds. And we did the same thing we did with the greyhounds: CBCs, profiles, thyroid, blood gases, blah, 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 blah. So we get back. This is really early in the morning. We get back about 5 in the morning, and I'm looking at blood smears. So the first blood smear that I look at, because I want to see what their eosinophils look like, is Burger. So Burger has an eosinophil that looks like that. So does that look like a normal eosinophil or like a greyhound eosinophil? Greyhound, all right? So we said, son of a gun, they have greyhound-looking eosinophils. So now if you look at a deerhound, it looks like a greyhound with a toupee, all right? So they're kind of like a slightly bigger greyhound with a little bit long hair. Okay, so the second blood smear you look at is Finn, and it looks like this. So what do you think about that? Is that a normal looking or not? Pretty normal looking, all right? So I'm going, son of a gun, you know, they have half and half. Third one is Dylan. You guys see vacuoles with a little red dot in the middle. Isn't that pretty? Okay. So we said, stop it, stop it, stop it, right here. So we stopped looking at blood smears, and I said, we're going to run this through the ProCyte. So we run the 3 through the ProCyte, and we look at the dot plots, okay? So I'm not going to bore you with any of that. So I'm going to show you Finn, that is the one that has the normal-looking eosinophils, okay? The instrument unequivocally recognizes the population of eosinophils. You know, it labels them in green. They are red. They're round. They're an apple. I'm going to call them eosinophils, okay? No problem with that. So this will be like a Labrador or any other dog. So look at what happens now when you look at Dylan. So Dylan is the one that has the vacuoles with a red dot in the middle. The instrument says most of these are eosinophils, but I'm not sure about those guys. You guys see the little lavender dots in there? You see that's a distinct cloud, okay? So the instrument says, because I am not sure, I'm going to throw some of this in the neutrophil cloud. I'm going to paint them lavender, so because I think they are neutrophils, okay? Now notice, I'm going to show them to you side by side. You see how much closer to the neutrophil cloud that is, okay? So when we looked at Burger, this is a greyhound eosinophil cloud, all right? So what actually happens is the instrument goes, well, now I'm in trouble because these guys don't look like the eosinophils that I learned about at school. So this I'm going to call eosinophils, but all these other guys I'm going to call neutrophils. So when you look at the numbers, what will happen? The EO numbers will be lower than the actual value, and the neutrophil numbers will be higher than the actual value. And you will have a little asterisk next to it that tells you, check the algorithm, all right? Or look at the blood smear or white cell distribution or whatever message you get. So what we did is as follows. We stopped right there, and we stained all the other smears. And what we did is I looked at all the dot plots, put them all in an Excel spreadsheet, and we coded them as 0, 1, or 2 as to whether they had granules, yes or no, and gray empty granules. And then we predicted what the morphology would be when we looked at them in the blood smear. and we blindly look at all the blood smears, and we nailed every single one of them from looking at the dot plots. So these dot plots are pretty darn cool, all right? So they work very, very well. So Brandy, we were talking about bone cancer today. Brandy is a 12-year-old black lab, rambunctious, playful black lab that has a distal radial osteosarc, lytic proliferative distal radial lesion. And, we see lots of bone cancer. We work with Children's Hospital at Ohio State, and we see, sometimes we will see 6, 8, 10 cases of bone cancer in a week. So we do sometimes 2 amputations a day. And we're always looking at new ways to treat cancer, because then we're going to use it to treat kids with osteosarc. Osteosarcoma is common in children. So Brandy comes in, normal physical, other than the leg. She has normal thoracic radiographs and CT, and we do a CBC and a profile that are fine. So I'm going to show you the pre-op numerical values on Brandy. So what do you think? What are the abnormalities that are helpfully color-coded for you? So is she anemic, yes or no? Yes. Is it mild, moderate, or severe? Mild. So if you were to be a guessing individual, what would be the most likely mechanism for that? Chronic disease, right? Because she has cancer, so that's your typical crit for a cancer dog. And what do you think about the leukogram? What type of leukogram does she have? Neutrophilia, monocytosis. The eos are on the low end and the limbs are on the low end, so what would you call it? Stress leukogram. So, this is your typical cancer dog CBC, so nothing to get too excited about. So the dot plots, not very many retakes, everything is good, platelets are fine, nothing to get too excited about. So she goes to surgery, and we amputate her leg, all right? So she does the pre-op, and this is the post-op. So what do you see different between the pre and the post-op? So now it's regenerating. This is 2 days after the surgery, so she bled. I was telling the group last night, if you amputate a leg in a 30-kilo dog, and that dog has a hematocrit of 50 preoperatively, the following day the hematocrit will be between 35 and 38. So there's a lot of blood in the leg, all right? So we do femoral disarticulation and removal from the chest wall. So they get really anemic, and if you give them 2 or 3 days, then they retic. So that's expected, okay? That is nothing to get too excited about. So we amputate her. She gets 4 doses of carboplatin. That is standard of care for most non-greyhounds with osteosarcoma, and we start her on an investigational program. We have, at OSU, we have a clinical trials office, and to give you an idea, right now we have probably 27 clinical trials going. So we develop drugs that eventually will be used in people with cancer or heart disease or whatever. So we do that by going from the test tube to the mouse to the dog, to the patient dog, and then we go to humans, as opposed to going to humans first and then coming back. A lot cheaper, a lot faster. So she comes in to try this new immunotherapy program that is a non-specific immunomodulator made with a genetically engineered Clostridium that does not reproduce. So you would give it IV as an infusion. It will cause a non-selective immunostimulation, and it will have the macrophages go and eat all the cancer cells that are left behind, in theory, okay? Little did we know that a week later, she's not feeling very well. So she comes to us, she vomited a couple of times, she doesn't want to eat, she's febrile, has a 41 temperature, and her abdomen bothers her. When we palpate her abdomen, she tenses up the abdomen, and she doesn't let you get a really good palpation. So I'm going to show you these 2 dot plots, the before and the after. So this is a year and a half ago. So we had the old algorithm for the white cells, okay? So do you guys see any differences in the clouds between the before and after? What catches your eye first? So if you look at the neutrophil cloud, is it a distinct cloud, or is it merging in with the limbs? It's blending in with the limbs, doesn't it? So what it's actually doing is, if you could actually select individual populations, you can already tell that this is one cloud, okay, and this is another cloud. But to the instrument, some of these cells that are kind of here against the lymphocyte look a little bit like neutrophils, look a little bit like lymphocytes. So what does the instrument do? It will give you an asterisk next to the cells, so you will have a white cell distribution issue. but typically it will also give you a straight line in between the populations, all right? So when you see this straight line in between the populations, the way I interpret that, and it's not exactly that way, but the way I interpret it is the instrument goes, I'm not sure what they are, so I'm going to draw this line here. I'm going to throw one on the left and one on the right, okay? Because they look a little bit like both. So I'm going to be throwing arbitrarily some cells in either direction. Have you guys seen a dot plot that looks like this? So Fred Metzger, who you will meet probably not too long from now, and I recommend that you stay away from him, particularly socially, because he's a very dangerous human being. He calls that the shark fin morphology, or the shark fin neutrophil cloud, and that, you guys, is a textbook left shift or toxic changes, all right? And I'll show you this graph here. So when you actually look at those are good old neutrophils, all right? And those are the bands that have a different nucleus and they have more stuff in the cytoplasm. So the instrument is not quite sure where it's going to put them. So now, before you had to look at the dot plot. Now it will give you that asterisk that is 2 spaces to your right, and it will say bands suspected. Right? That's at least the message in the States. So when the instrument tells you bands suspected, look at the damn smear, because the bands are going to be there, okay? It works very, very well. So what do you think about her white count? Mildly increased, moderately increased, severely increased. 80,000 is a lot, all right? So she could be a leukocyte donor, okay? She could be giving leukocytes to other patients. So she's more anemic, and she has neutrophilia. And so look at the limbs are high because it's putting a lot of this, it's counting a lot of his cells as limbs, all right? So then I'm going to show you the blood smears so that you hopefully believe me after we do that. Too many buttons to push. You see what happens here? All right. So this is her blood smear. So she has rouleau formation, as you can see, and that means that she's a little anemic and she has a high globulin. She has nice left shift with toxic changes. That's a toxic metamyelocyte. That's between a band and a metamyelocyte, and that's a toxic, likely band, and again, depends upon who looks at it, and that's a reactive lymphocyte. So again, and I'm going to bore you with all that, but pretty easy to recognize. So and again, this is with the old algorithm, so we had to look at the cloud and then go look at the cells. Okay. So what do you think may be going on with our good old friend here? She has a painful abdomen. She has a marked neutrophilia with left shift monocytosis. So she could have peritonitis, all right? And remember, we gave her a drug that we had never used before, a biological we had never used before. So we ultrasound her abdomen, and there is this thing, all right, in the middle of the abdomen. So it's a mass that is about 10 centimeters in diameter, and it has gas shadows. So is that a good thing or a bad thing? Yeah. Probably not a good thing, okay? So what do all the oncologists do when they find the mass? What do we put into it? A needle, there you go. So we put a needle, and this is what we got. Okay, so all this is basically DNA puree, all right? So these are all necrotic cells, so pus, basically, or necrosis. What do you think those are? Do you think they're bacteria? Those are Clostridia, all right? Remember the ones that were not supposed to reproduce because they are genetically engineered and they had been castrated? They had not been castrated. So what this was, you guys, is she had a lipoma in the omentum that got colonized with the Clostridia and developed gangrene, basically gas gangrene in the lipoma. So we took her to surgery. She did great. We took that out, and yes, she was the first dog in the study. Yes, she was the last dog in the study, so it did not work out very well. But Brandy's still doing well, so actually she's a good girl. So then just to show you the progression, and again, anytime you see this, you will see that a lot in dogs, for example, with IHA, because remember, they are really left shifted. So if you look at those two side by side, you have a really regenerative anemia, and you have a nice left shift. Start looking for spherocytes, because that's going to help you a lot. Okay, so this is a disaster, all right? Anytime that a dog is owned by a veterinary student, something bad is going to happen. So this is Ashley. who owns Monster, and Ashley is one of my daughter's best friend. My daughter graduated this year from veterinary school, and Ashley is starting oncology this week. And Monster, who's a 3-year-old big husky, about 40-kilo husky that she adopted after being hit by a car, and they had to amputate the leg and whatnot, has not been feeling well since last night. So he was perfect, ate dinner, and then he woke up in the middle of the night and is salivating, is panting, is acting anxious. She doesn't know what's going on. So we do a physical exam, and he may be a little pale, but I am not too excited about the color of his gums. But he definitely has cranial abdominal organomegaly. He's a big dog, so I cannot tell if it's the spleen or the liver. He's a student dog, so we're not going to spend any more money at the moment because the students cannot afford it. So we do a CBC and a profile. So a profile is normal, nothing to get excited about. So I'm going to show you the CBC. So anemic, yes or no? Yes. Mild, moderate, or severe? What do you think, 33? Mild, right? So you could say the same thing that we said with Brandy, you know, anemia of chronic disease. Problem is, he was a happy dog until last night, so that doesn't quite fit very well. So can you guys read from there the neutrophil count? 0.96. What do you think, mild, moderate, or severe? Yeah, well, yeah, oncologists will call that moderate. You know, severe is 0. So anything between 0 and 500 is sort of severe, and 500 and up is kind of moderate. So, and what do you think? So monos are up. Okay, so she has neutropenia, monocytosis, and she has a platelet count of 49,000. Okay? So mild anemia, I'm not going to show you the retics quite yet, but you're guessing that it will be normocytic, normochromic, hence non-regenerative. Okay? I'm going to show you dot plots in a minute. So give me some differential diagnosis for Monster. 3-year-old, male castrated, mixed breed dog, acute onset of not feeling well, salivating, cranial abdominal organomegaly with this CBC. What would you like to put in the list for this CBC? So would you agree with me that he's pancytopenic, so he's anemic, neutropenic, thrombocytopenic, okay? We don't see reticulocytes, so quite likely the anemia will be non-regenerative. And if you have pancytopenic dog with non-regenerative anemia, and you're a betting individual, you like to play with money, do you put it in the bone marrow pile or do you put it in the peripheral circulation pile? Bone marrow, right? So what we're saying is Monster likely has primary bone marrow disease or secondary bone marrow disease. So do you want to give me some differential diagnosis for what he may have? You're going to be able to when I show you the dot plots. But so what, are there any bone marrow diseases that can do this? Could he have ehrlichiosis or anaplasmosis? So Ehrlichia will be likely, anaplasma will be unlikely, okay? What is the problem? His protein is normal. So if you have an Ehrlichia dog that gets neutropenic and thrombocytopenic, usually they have a globulin that is really, really high. So that's the thing that is missing in the lab work, okay? What else could he have? Lymphoma. She could have lymphoma. What else? What is the primary hemopoietic tumor of the bone marrow? Leukemia, right? So it could have leukemia, or could be bone marrow hypoplasia, or myelofibrosis. She doesn't. We haven't looked at the blood smear yet. Okay, so I'm going to show you the dot plot. So is the anemia regenerative or not? No. All right. And what do you think? I'm going to show you the Monster's dot plot. What do you see? So obviously not very many neutrophils and not very many limbs, but what is peculiar about the monocyte cloud? What is different? So these ones, they kind of get thinner as they go up, okay? You see how this one gets wider as it goes up? So that's what we call the tornado cloud, okay? So remember, the cells that are up here are cells that have a very, very big nucleus, right? Because they're on the upper limit of the fluorescence, okay? And they are on this side because they are really complex. So you're thinking their cytoplasm is going to have vacuoles and they have a really big nucleus, okay? So what do you think? Are they going to be good cells or bad cells? Bad cells, all right? Because you're saying the instrument is putting them at the very top, and there's almost a horizontal line in there because they cannot go any higher, all right? So this guy is a big nuclei. So I'm not going to show you that one. I'm going to show you, so this is a blood smear. So what do you think? So that's a neutrophil, and is that a normal blood cell? Can you recognize that? No. So that's some sort of a blast, and it has a kidney-shaped nucleus with nucleoli, so it's probably myeloid in origin. So it's probably, between a myelocyte, metamyelocyte, or something along those lines. But remember, a myelocyte should not have nucleoli, so there's asynchronous nuclear cytoplasmic maturation in there. So when we see that, and you can see this blood is not a good sample because it's cremated, but typical. Somebody else made the slide and it was not very good. So what do you think? Is this a good disease or a bad disease? So how would we document it? Where would we look next? We'll do a marrow, all right? So that's our marrow, his marrow, sorry. So there's a nucleated red cell in there, and then the rest of the cells are this, myeloid-looking population of cells. We did flow cytometry, and they are myeloid, and basically he had AML, acute myeloid leukemia. Normal dog, 1 minute, sick the next, dead next week. So that's the way a lot of the acute leukemias are. Really, really bad deal. So remember, a lot of the AML dogs are sudden deaths. You will find it on a necropsy, and they're in Ohio. They're usually 1 to 3 years of age, like children. You remember, leukemia is very common in children and kids. So this was an absolute disaster. All right. So let me show you the last one, and then we'll look at your case. And this is a very easy one. Chewy is a mixed breed, 4-year-old dog that has lymphoma and is getting CHOP chemotherapy. So he's doing great, feeling well at home, comes in for his next vincristine, and here's his CBC. Anything that bothers you? Something that could be in blue, perhaps? So he has low platelets, all right? But again, do you notice that there is an asterisk in there? And you notice that it says platelet aggregates detected, okay? I am not sure why, you guys, but nobody pays attention to that. In the States, nobody reads the messages. And what I usually tell the IDEX guys is it should be in font about this big. It should be red, blue, purple, green, and orange. And it should have some sort of an insult so you can actually get angry and go and look at the blood slide, all right? So we're not going to look at the blood smear yet. First, we're going to look at the dot plots. And this is kind of interesting because when you have platelet aggregates, when you get an optical platelet count, you usually get really good platelets, and he does not have good platelet numbers in there, all right? So you go, well, maybe it is real, and the machine messed up. So now we look at the white cell dot plot. So can you guys see a clear eosinophil cloud? So what do you see? Can you see something that makes like a little arch? Can you guys see those analyzed red cells, how they arch up and they blend with what the instrument thinks are funny eosinophils? All these are platelet clumps, okay? So you will actually get this low eosinophil number when you look at the total count because what the instrument is counting as some of the eos are actually platelet clumps. So this curved arching structure is typical of platelet clumps. All right, so you can look at that and nail them right away. And this is the feathered edge of the slide. So we actually told Chewy that he was fine, he was happy, and he got his vincristine and did really well. And I'll show you this last two real quick. So remember I was telling you, when you have a very strongly regenerative response, you also frequently get a left shift. Nice regeneration. Ginger actually was a rodenticide toxicity dog that we got about 2 days after she started bleeding. And Teddy, what do you think about those retics, eh? Woo! All right? So that actually calls for a celebration. And this is an IHA dog, and see those nice left shifts in there. Now remember, the nucleated reds also hide in this one area, okay? So the nucleated reds usually end up in the neutrophil cloud, but the instrument will alert you that they are nucleated reds. So basically, what did I want to gain from this little get-together? I really encourage you to look at dot plots. When I read a CBC, you guys, I start from the dot plots up, all right? I don't look at the numbers first, I look at the clouds, and then I look at the numbers, and then I look at the smears if the numbers are wrong or the clouds are abnormal. So as I was telling you, I don't look at every CBC blood smear-wise. So bottom line is, if you need anything that I can help you with, email me, and I'll be happy to help you. If you have any dot plot questions and whatnot, I'll be glad to help. And I think, I don't know, we have handouts for you guys, but I am not sure. We have them, and we're going to get them to you. So we have basically a PDF of the presentation, so you will get all the slides. And actually, we'll get more slides because it's the long presentation. So, and if you like rural Spain, and if you like to spend a vacation spaying and neutering dogs and having a great time with great camaraderie, eating well, drinking well, not paying €7 per beer, but 70 cents per beer, we invite you to come and help us. We go 3-4 times a year to a shelter in rural Spain. It's called Scooby, and it's in Medina del Campo, that is near Valladolid in the central plains of Spain in Castilla. And we have a great time. Yeah, we spay and neuter anywhere between 20 and 100 dogs per trip. This trip 2 weeks ago, we had 27 veterinarians and 7 veterinary students. We do ultrasound workshops, we do cytology workshops, we do rounds every evening. It's pretty good. It's a really good camaraderie and educational activity. And it's a tiny little place, so the hotels are like €40 a night or something like that, very inexpensive. So if you're interested in ever coming over, we have vets from all over the place. We had Americans, Brits, Dutch vets, Belgian, you name it. We had lots of different people, and it's a great experience. You come back with a few extra kilograms, but that's all right. Yes, you can then go to the gym. So, okay, so questions about this, and then we're going to look at this. I already looked at the dot plots, and I went like, ooh. All right. Questions, you guys? So tell us about Betty.
Betty is a 10-year-old spring spaniel.
Mm-hmm. Ooh, nice.
With pale mucous membranes. And Betty is a 10-year-old spring spaniel with pale mucous membranes, lethargic, and with vaginal discharge.
And did you look at the vaginal discharge cytologically, or?
No, but it was very red.
Okay, so it's red. Okay.
Yeah.
So let me tell you what we have. We cannot project this. So we have a hematocrit of 20. Okay. Can you guys see the graphics from there or not? Can you see them well enough to tell me if the anemia is regenerative or not? Yes, lots of pink stuff. All right. And then if you look at this, you can see that there is a left shift or toxic changes, like the one that I showed you before. Okay, so we're going to look at the blood smear. So the issue is, why does she have vaginal discharge? And remember, one of our tasks as clinicians is to sort things out. And remember, I always tell the students, it's like when we were children and they gave us these dots with numbers, and we had to connect the dots and then draw a dog or draw a cat or whatever, and we need to connect the dots, all right? And sometimes you have an extra dot that you cannot connect, and that usually means that this is unrelated to what the dog has. Now, it could be related, okay? So what I would do first, because I'm an oncologist, I would put a swab and look at the cells, all right, and see if they are neutrophils, because remember, it can look bloody from pyometra or mucometra or hemorrhage or whatever. If there is volume of fluid, anytime I see any fluid with blood, I do a hematocrit, just to see how much blood is in there, and then I look at it cytologically. So we have a Springer Spaniel with regenerative anemia and a left shift. What will be two diseases, which will be your top differential for that dog? It's a Springer Spaniel, so it's genetically predisposed, just like their cousin. Immune-mediated hemolytic anemia, right? So that would be one. So did you guys ever hear about PFK deficiency? Do you guys remember how many of you remember the Emden-Meyerhof cycle from chemistry? Nah. How about the Krebs cycle? Anybody remembers the Krebs cycle? Yeah, right. You're going to go draw it there. And so you guys remember the PFK, phosphofructokinase, is in the Emden-Meyerhof cycle. So you use that to generate 2,3-diphosphoglycerate. And Springers, frequently in the States, about half of them are congenitally deficient on PFK. So when you do not have PFK, what actually happens is you hemolyze. And the reason you hemolyze is because your red cells become very sensitive to high pH, all right? So let me tell you how it happens in the States. We see lots of springers with PFK deficiency. These are usually younger dogs, all right? So this may not apply to Betty. So they go out on a field trial. How are your Springer Spaniels in Sweden calm dogs, or are they? All right, so they're like Goofy in the Disney shows, all right? So these dogs are field trial dogs or are very excitable dogs. So what happens to acid base when you pant excessively? What happens? You get respiratory alkalosis, all right? So when you get respiratory alkalosis, you get intravascular hemolysis. And if you don't hemolyze like crazy, and remember, they frequently have profound hemoglobinuria, profound. And the question is, could this be urine coming out of a vaginal vault, you know? So then what actually happens is you damage the membrane and they get chewed up as they go through the spleen. So you also can get spherocytes. So the deal is, we have springers that we cannot have them come to the vet because when they get in the car, they start doing all this and they hemolyze. And they are oftentimes misdiagnosed as having immune-mediated hemolytic anemia. So what would we look for? So obviously we will look for lots of spherocytes and no red cell ghosts. You know, the red cell ghosts are the pieces of membrane that are left behind after the red cells explode. So if you have intravascular hemolysis, you should have actually some red cell ghosts. So we're going to go to work, should we? So what I need to do is I need to disconnect my projector and connect. Oh, and you know what? We don't have oil for the microscope. I'm wondering if we can grab some immersion oil. Let's see. So we will soon get this, hopefully, sorted out. So we will turn the lights on once we find them. So let's say, good. So if you guys like cytology and hematology, remember you use the scope the opposite way as when you look at skin and sediment. So you want condenser up and diaphragm wide open. So you want all the light you can coming in. How many of you remember color illumination? KOEHLER? Have you guys ever done that? Oh, thanks. So remember, what you do with that is if you have an Abbey condenser, this is not an Abbey condenser, you actually line up the beam of light so the light is not basically bouncing off the tubes. So we'll see, great. Yeah, if you could, that would be fantastic. Okay, so we're going to see. And remember, the name of the game is, can we tell what Betty has? And more important yet is, can we tell what Betty has at low power? We're going to this is a nice scope. You guys cannot handle the suspense, can you? Woo! Oh my God! No, it's okay. Nothing happened. And did you spin down a hematocrit? No. It'd be nice to look at the color of the plasma because there is some stuff here that looks like it could be hemoglobin crystals. So if she has PFK deficiency, she will have really, really red plasma. She should have really red plasma. Ooh. So once we get the screen up, I will show you what's going on here, but it's very, very, it's almost psychedelic. You were not receiving any, there you go. You were not under the influence when you made this mirror. Oh, okay, good. So can you guys see that, let me grab my pointer here. This is almost makes you feel like a sharpshooter with a thing in there. So this, you guys, is a red cell, and can you guys see how there is hemoglobin shooting out of the red cell? I don't think that is smear preparation. I think it's real because it's going in every direction. So I've never seen that, so I don't know what the hell it means. So we'll get there here in a second. So her neutrophils seem to be happy. She has plenty of platelets. And let me see if I can show you this. This is probably not going to project very well. So do you see a platelet in there? You see a normalish red cell? You see how that is a very pale looking red cell? So that looks like a red cell ghost. Okay, so it looks like an empty red cell. Yeah, if we could, that would be great. Yeah. Can we? So far, I don't see any spherocytes. But look at this is amazing because all that seems to be hemoglobin crystals, you know, like shooting out of a red cell. I've never seen that before. And remember, if it's a smearing artifact, they will all be pointing in the same direction because you will be dragging them. But these ones are pointing 360 degrees around. So I think that this is the real deal. Okay, this is nice. Maybe you have your first PFK deficient dog. First report and review of the literature. Yeah. But I tell you, there's a lot of what I think are red cell ghosts, you know. Here's two really, really pretty ones, and they are so pretty. Can you guys see that one? And that one, and that one, and that one? So those are red cell ghosts. So I would think that PFK deficiency will be high in the list, and I would spin a hematocrit and see if her plasma is red. Now, do you remember how old was the blood before they made the smear?
1 hour tops.
Okay, no, so then that's good. Well, because you know sometimes you get blood that comes in, you know, it comes in a tube from 500 kilometers away and it's messed up. So I'm going to show you. Let me put it further up. So if you did not know that her name was Betty, all right, could you tell me if she's a male or a female? You guys see the drumstick? That's the sex chromatin right there. So that's the bar body or sex chromatin. So that makes her a girl, as she should. Yeah, but I tell you, this is really. You guys can do photographs with this scope. Yes, probably. I would love to get pictures of this if you guys don't mind. But you see all these crystals shooting out? This is going to be really, really cool, actually. So look at that. Looks like a little snowman, you see, with the little legs and the body and everything. So
Could you make the dog acidify? I mean,
yeah.
before you go to the vet or something?
Yeah, I tell you, there is a lot of, if you guys look at the literature, you know, Urs Giger from Penn wrote most of the papers on this, and what you basically need to do is you need to calm them down. So the best drug for this is usually acepromazine or something along those lines. So the issue is, do you guys know if IDEX runs PFK assays? Because, you know, the vet school at Pennsylvania will do a chemical assay in the blood, and they will also do a genetic assay. They know exactly the gene mutations in the dog, so you can even do a swab of the buccal mucosa and send it that way. But if she has PFK deficiency, she should have really, really pink or red plasma, and I would not be surprised if what's coming out of her vagina could be urine. You know, it could be. Did you guys do a cystocentesis to see if the urine is red?
It came in this morning, actually.
Okay, great.
I don't know the results. Yes.
So you have to give me a follow-up. You have to promise me that you give me a follow-up. So, yeah, this is really cool. So, little did you know that we were going to find a weird case, eh? Yeah, and I tell you, there isn't really, the one thing is I'm still not seeing those toxic cells and left-shifted neutrophils. There's a monocyte and 2 neutrophils there, ready to be shot. There's a lymphocyte. You know, if this is a fresh sample, like you were telling me, you guys see the cell in the middle, how it looks like the nucleus is like falling apart. It almost looks like the nucleus is fuzzy or irregular. That is probably a toxic change. The only thing that bothers me is that the cytoplasm doesn't look bad. Say it again.
I asked if they had CRP.
Oh, you guys can do CRP, that's right. Well, there you go. So there's a, that's likely a band, okay? So the one that we're ready to shoot. So it's actually, so remember, when you think about a band, you think about the band looking at it from above, but this one is folded, okay? Ooh. I thought it was time for the dance. I thought Cesar was going to do a dance on the table right now. So this, you guys, is a band, but the one of the legs is looking at us, so it's folded. You know, the one on the right. So now, to be quite honest, the red cells are so messed up that, yeah, you can tell there is some polychromatophilic red cells, but you cannot really. You will have to believe me, that one has a little bit of a blue tinge to the cytoplasm. And the other thing that I don't know is, I would suspect, so if you, I'll pass you this red cell curve, but when you look at the bottom of the red cell curve, there is a lot of extra dots that you usually don't see in a normal dog. Maybe those are pieces of red cells, you know, I don't know for sure. Bless you. Yeah, so there's toxic changes. There's another nice sex chromatin, that bar body in there. You know, what I need to do is I got to go and look up some of the original papers, but I've never seen red cells that look like that with all that hemoglobin shooting out of the red cells. It's very strange. So the other thing that I was looking at, so you guys remember the instrument counts the red cells, then it lyses them and measures the hemoglobin. So it measures the hemoglobin in solution. So typically, if you have intravascular hemolysis, there is more, quote unquote, hemoglobin in the sample that you can account for based on the red cells, because you have all that hemoglobin floating in between the red cells. So what that usually means is that your MCHC goes up, but her MCHC is normal. And her MCV is a little small, you know, it's like 57.5, but I tell you, this is really, really interesting. Is she really sick?
Yeah, she was quite sick, yeah.
Man. Yeah, so if she's a very excitable dog, the first thing I would do is I would calm her down with something that...
Should it be like for example, in a dog with
You bet, sure. Oh yeah, yeah. So remember, so that could be the right. That could be the extra dot, you know. So what would I do if I were looking at her? So I would really do a good abdominal palpation if I don't have ultrasound, and make sure you don't palpate the uterus, and I would ultrasound her and see if the bladder, you know, looks good, and get a cysto and do a UA, you know, and see if you have no red cells and a lot of positive blood on the dipstick. She probably has myoglobin. I would hemoglobin. I would spin a hematocrit and see what the. I remember as we get these instruments, we've gotten into the habit of not spinning hematocrits, because we go, the machine is giving me a good hematocrit, but we forget that the machine is not looking at the color of the plasma. So that helps you if you have a dog with hemolysis. And then I would also do a protein just to make sure the protein should be normal. But really interesting case. Now the problem that you have is that there is no treatment. You know, there is, you know, all you need to do is you need to calm them down. But and if you email me, I can send you the papers. They are old papers, but there is a recent paper on the actual gene mutation. But the clinical papers are really, really old. Giger and John Harvey, when Giger was in Florida. So this is 30 years ago or something like that. So that will be the best fitting scenario. Now the question that immediately comes to mind is, why would a dog her age start hemolyzing now? And maybe she has a pyometran that actually push her over the edge, and, you know, before she had minor crisis. I mean, there are dogs that So remember when we were talking about dogs with normal hematocrit and lots of reticulocytes? You will see springers like that because they have intermittent hemolysis. When they go out running, they hemolyze, but maybe their crit gets from 45 to 40, and they retic, and then you see those retics floating around. That'd be kind of interesting. But you have to promise me you're going to follow up and let me know. All right. So what else do you guys want to do? Or at what time are we supposed to be done? 6 or 6:30? 6? Like now is what you're saying. Oh my God, we've gone over. We've gone over by about 15 seconds. All right. So this will end up being the coolest case of the day, probably, or the month, or the year, or something like that. So in any event, question: are you guys going to go tomorrow and look at dot plots? Yes. Good. Anything that I can help you with, let me know, because I'll be glad to. And if you want to look at, so let's say you have a funky or a funny dot plot. First, let me ask you, do you have the ProSite connected to a computer, or you have just the IVLS? Is it connected to a computer? Yes. Good. So if it is connected to a computer, you can actually, if you have a PDF reader, you can save the report as a PDF file, and you can email it to me. So you can actually do that. And if you have funny dot plots, email them to me, and I'll be happy to look at them and send you comments, or send you other dot plots that look like that, or whatever works. So, see? All right, guys. Thank you for coming. Thanks for staying, and hopefully you learn a couple of tricks. That's the only thing that matters. Thanks.